Let's discuss about schizophrenia. Definition: schizophrenia is a group of psychotic disorders characterized by disturbances in thinking, emotions, interpersonal relationships, volitions, and faculties in the presence of clear consciousness. When we hear this definition, it may be confusing for us. But when you look at this definition clearly, you can see that it's a group of psychotic disorders, and the characterization or the characteristics of these disorders are disturbance in thinking. So, the patient will have disturbance in thinking, emotions, then interpersonal relationship, how the patient is interacting with others, how he is interacting with the society. So there will be disturbance in the interpersonal relationship. Then volitions and faculties. Volitions and faculties means the abilities, and volitions means the ability to make determinations or decisions. All these comes under volitions. So those patients with schizophrenia will have problems in thinking, emotions, relationship problems, then volitions and faculties, which means problems in taking decisions, and the other problems in willpower or the other abilities. But the thing is, even though the patient is having all these problems, the patient will have clear consciousness. So this is the main point. Even though the patient is having these disturbance, patient will have clear consciousness. First time Eugene Blur, he coined the word, or he coined the term schizophrenia. Let's see types of schizophrenia before seeing the symptoms. There are different types of schizophrenia: paranoid, catatonic, disorganized, residual, and undifferentiated. How we classified these types means it is according to the symptoms or the group of symptoms which the patient is showing. According to the symptoms, according to the prominent symptoms, we are classifying these types. Let's see the symptoms of paranoid schizophrenia. In the paranoid schizophrenia, the patient will have suspiciousness. The patient will doubt everyone. The patient will have delusions. Delusion means false, unshakable belief. The patient will have a false belief. Even though there will not be any evidence for that belief, patient will have that false unshakable belief, and this belief will be different types. Sometimes delusion of grandeur means patient believe that he is powerful and important person. Sometimes delusion of jealousy, which means that patient believe that his or her partner is in a relationship with other person. And there is one type of delusion of persecution, which means that the patient is thinking that somebody is trying to attack him or harm him. So these types of delusions will be there. Then patient will have auditory hallucination, which means patient will hear some type of words or sounds, even though there is no such a sound is coming, but patient will feel or he will hear a type of sounds. Then patient will have anxiety. Then persecutory themes. Persecutory themes means the patient is thinking that somebody is going to attack him or kill him. Then violence. So these are the predominant or the prominent symptoms of paranoid schizophrenia. So you can see that in paranoid schizophrenia, a patient doubt or he is suspicious about others, or patient will have delusions. In all of the symptoms, you can see the patient is doubtful or patient is doubting others. So this is called paranoid schizophrenia. In case of husband and wife, you can see the husband will doubt the wife. it's type of paranoid schizophrenia. So the prominent symptom will be doubt or suspiciousness. Um, so based on these prominent symptoms, we classify this schizophrenia. The second one is catatonic. Catatonic is mainly related to the motor activities of the patient. So here what will have, the patient will have more psychomotor disturbance. Yes, catatonic schizophrenia patient will have other problems like thinking problems, emotion problems, and other problems which I explained earlier. But here the main symptoms will be related to motor activities. Like patient will have psychomotor disturbance. Sometimes patient will show increased body movement or repeated movement of the body, and sometimes immobility. Sometimes patient will not move anywhere, immobility will be there. Then waxy flexibility. Waxy flexibility means patient will remain in a posture or in a position for hours. For hours he will or put his leg or hand or his whole body in a different difficult position for long hour. This is called waxy flexibility. Stupor, echolalia. Echolalia means patient will repeat the words of others. If we are asking something, the patient will repeat the same question or same sentence what we said. Like the patient will repeat others' words. That is echolalia. Sometimes automatic obedience. It's like he will act like a robot. Whatever you say, he will do. Or uh, like like he will show extra obedience, that is automatic obedience. Then stereotyped behavior, sometimes he will do the motor activities repeatedly, same activity, same movement he will do repeatedly. Stereotyped behavior. So in catatonic schizophrenia, even though the patient is having all other problems, the main problems will be related to motor activities, that is catatonic schizophrenia. A third one is disorganized. In disorganized, nothing will be organized. In this, nothing will be organized. Mainly, disturbance in speech. When the patient will talk, there will not be any organization. There will not be any coordination. Other problems you can see: social withdrawal. Patient will be will have social withdrawal. Then flat affect. Affect means emotions. You know emotions. The way we express emotions is called affect. If I feel happy, I will smile. That is the affect. So here flat affect. There will not be any expression of emotions. No expression of emotions. Like if patient is feeling happy, he will not smile. There will not be any emotions on his face. If the patient is feeling sadness, also he will not show any type of expressions. His face will be blank. So that is flat effect. Sometimes grimacing will be there, grimacing look will be there. Then he cannot perform daily activities. Then disturbance in speech, like he cannot organize or coordinate his speech. There will not be any coordination or any association in his speech. When he will start something and he will end in something, and there will not be any connection between his language or between his ideas. So that is disturbance in speech. Then residual means for some patient there will be a history of schizophrenia. Sometimes patient had a schizophrenia attack maybe a year ago or 5 year ago, and again it will comes, and this it will stay, or this a problem will be their patient for another 2 or 3 years, or sometimes some episodes, some repeated episodes. We can say the patient is already is having a schizophrenia problem before he had a episode, then it was resolved, and maybe patient became normal, then again the same problem is coming after 1 year or 2 year, whatever it is. So this is residual schizophrenia. In this also patient will show social withdrawal. And the other type is undifferentiated. In undifferentiated schizophrenia, you cannot differentiate into any types, because he will show mixed type of symptoms. Sometimes he will show symptoms of paranoid schizophrenia. Sometimes he will show disorganized schizophrenia symptoms. So there will be mixed types of symptoms, that is called undifferentiated. As I said before, Eugene Bloor, he coined the word schizophrenia, and he also he said that there is a main four symptoms for schizophrenia, known as four A's of schizophrenia. It is very important. The first one is he is telling autistic thinking. Mm, we can call it as general symptoms. Before I discuss about the particular or the main special symptoms you can see in each type. Now I just giving you the general symptoms of schizophrenia. The four general symptoms which known as 4A's of schizophrenia, 4A, because all symptoms start with A, that is why 4A of schizophrenia is autistic thinking. Autistic thinking means patient uh, always he will be preoccupied with his thought, inner thoughts, daydreaming, fantasy. He will be he will not be in touch with the society. There will be social withdrawal. He will be always thinking about, or he will be busy with his thoughts, inner thoughts. Then fantasy, daydreaming, all those things are known as autistic thinking. Then ambivalence, patient cannot take any decision, or his decisions or judgment will be changed frequently, so ambivalence will be there. Then affective disturbance, as I told, affect means the way you express your feelings or emotions. So affective disturbance, sometimes if you are happy, normally we will be smiling, or the special expressions which is related to that emotions we will show. But here there will not be any expressions of emotions. His face will be like blank. Then associative lucency mean when he talks, or when he there will be problems in his language or speech, like flight of ideas, loosening of association, which means circumstantiality, which means that he will start with some idea or some speech or thought, and suddenly his thought will change to some other thing. There will not be any association or any connection. So these are the four general symptoms of schizophrenia. So overall, when you see schizophrenia, sometimes it may be confusing. When you read books or when you see the symptoms, it may be confusing. So to make it clear, I can say you that schizophrenia, once again I will tell you, it's a group of psychotic disorder. So, and in this disorder, patient will have disturbance in thinking, in his emotions, relationships, and judgment, but the patient will have clear consciousness. Apart from these, we can see a lot of other language problem, motor disturbance, etc., etc. So depends upon the types we can see. As I told, in paranoid, you can see the patient is doubting everyone, there will be hallucination. Then in catatonic, different type of position he will show, I mean, he will maintain different type of posture. Then social withdrawal and flat affect in disorganized schizophrenia. In residual schizophrenia, if patient is having history, it is called residual, which means there was some problem before, that is meaning of residual, or there was something before inside, that is residual, the meaning of residual. Then disorganized, residual, then undifferentiated. So don't get confused with schizophrenia. When you think about schizophrenia, just think these four symptoms, and two things you have to remember. The one is patient will have hallucination. Schizophrenia patient will have hallucination, mainly auditory hallucination, and patient will have delusion. If it is paranoid schizophrenia, patient will have delusion of jealousy or delusion of persecution, etc. So delusion and hallucination will be there in schizophrenia. So most of the time the questions will be covering related to these symptoms, delusion and hallucination. Next, we can see the treatment. When it comes to treatment, we can give patient antipsychotic, of course, because it is a psychotic problems. So antipsychotic, example risperidone, clozapine, then antidepressant, mood stabilizer, benzodiazepine, then electroconvulsion therapy, then other psychotherapies like behavior therapy, group therapy, family therapy, all these treatments you can see. Next, when it comes to the nursing interventions, the main key points you have to remember when you attend the exam, whatever the exam, or the questions mainly when it comes related to nursing intervention, the answer when you are going to write the answer or select the answer, just keep these key points. When a patient is having schizophrenia, or if the patient is having delusion, hallucination, all these problems, uh, keep these three key points. One is safe environment. Always provide safe environment for the patient, because as I told that there is a delusion, and as there is hallucination, and not only all these things, the other motor disturbance, these will create problems or risk for the patient to get other injuries, or sometimes patient may attack others, or as you know, the patient may will have more violence or anxiety. So you have to provide safe environment. This is the first key concept you have to remember when you care a patient with the problem with the problem of schizophrenic symptoms. Then the second important point is manage delusions, because as I told that there will be delusion. Delusion means the patient is having a false belief. Whatever evidence or whatever you give explanation you give to the patient, he will not understand. He will always stand on his idea or on his belief, so it is a false belief. So we have to manage these delusions. So when you manage delusions, never uh, never argue with the client, or tell that whatever you are, or try to convince the client that these thinking, your thinking or your delusions are false. Never argue with the patient. You can interact with the patient on reality, and you can tell the patient to express his feelings, but never argue with the patient telling that your beliefs are wrong. And never and ever tell the patient that your beliefs are right also. Never agree that it is a right, but you tell that this is the reality. Sometimes patient will agree, sometimes patient will not agree. It is not none of our business. uh, but you do not go and argue with the patient. Then whenever you give food or something for the patient, do not give in a can or in a packaged food or something, because the patient is having delusion. Sometimes patient is thinking that others are trying to kill me or harm me or attack me, because patient is having delusion of grandeur, sorry, delusion of persecution. So this patient will think that those food which are giving from the hospital is containing poison, or they are trying to kill him by giving poisonous food. So never give food in a closed manner, like in a can or in a packaged food. Then on a one-to-one basis you have to talk with the patient and interact. Always interact with reality. Do not talk with the fantasy or imaginary things. So when you deal with the delusion, you have to think two things. One is, do not argue with the patient, and do not give food. Telling example, like do not give food in a canned container, or something like that, which the patient will think that okay, he is going to harm me. So there will not be any proper relationship, or nurse patient relationship will not be there. So please remember this point: managing delusions. Then manage hallucination. When we manage hallucination, you have to first ask the patient what type of hallucination he is having. Some patient will have auditory, like he will hear voices, and but there will not be any actual voice will, or sound will not be there. Some people will have olfactory hallucination, like they will smell like things, different smells, but when there will not be any smell, such a smell exists there. Then tactile, which means that the patient is tactile hallucination, which means patient will tell that somebody is touching me. Or visual hallucination, he will see something, like they will say that my father, maybe father died many years ago, but he will tell that my patient, I can see my patient, I can see somebody, but actually there will not be anyone. So when you deal with the hallucination patient, um, some patient will tell you that somebody is standing there, somebody is saying something, but you don't act that okay, I can hear, yeah, yeah, I can see. Don't tell him that you see them. Okay, you tell them that okay, it's up to you, you can see but I cannot see. You can tell the reality to the patient, but never argue with the patient. And uh, try to reduce the stimuli or the situations in which the patient will feel more hallucination, or there will be more chance for the hallucination. So avoid that type of situations. Then do not without his permission or without his awareness, don't come inside his hospital, oh sorry, room. And in some case, avoid touching the client. Like some people, what they will do, they will without any sound or without any prior information or permission, they will touch the patient. So don't do that, because he will get fear, he will think that sometime he will think that it is a hallucination, or sometime he will think that it will go to like delusions, like patient, somebody is going to attack the patient. So don't touch the patient without his permission or from the back or something like that. So these are the three key points you have to remember. One is safe environment, manage delusions, and manage hallucination. Most of the time the questions will the nursing intervention questions will come related to these nursing interventions. So keep these points in your mind and try to attend the answer, so you will get the correct answer. So these are the some of the main things regarding schizophrenia.